guys. Thank you so much for joining us today. Without further ado, I will hand the floor over to you, Mitzi, to get the panel underway.
Terrific. Thank you, Julia. It's a pleasure to be here. I'm Mitzi Crockover. I'm an internist and women's health specialist, and I'm also managing director of Golden Seeds, which is an angel investment organization focused on funding early stage women-led companies. I co-chair the health sector group that looks at everything from life sciences to wellness. And of course, my sweet spot is femtech. So I'm so delighted to be here with these three incredible entrepreneurs and have this conversation today. Many entrepreneurs, especially in the femtech space, have identified pain points that were born out of their own experience or that of loved ones, and they've created companies to provide solutions. We have a great panel of women entrepreneurs, as I said, who've actually created companies in that very space, and I'm really excited. I will have them introduce themselves, their companies, and perhaps tell us what those pain points were that drove them to establish their companies. And I'll start with Caitlin Christine.
Sure. Hi there. My name is Caitlin Christine, and I'm the CEO and founder at Gabby. At Gabby, we're on a mission to decrease delayed diagnosis, and we're starting with breast cancer. We've created an AI algorithm that can predict a woman's 2-year and lifetime risk of breast cancer, and then the first ever consumer-facing app that connects a woman's health records to guide her through the necessary preventative steps, ultimately to an early detection. And I believe the question was, Mitzi, why did I start this company? What prompted this? Well, for me, Gabby is deeply, deeply personal. I lost my mom to breast cancer due to a delayed diagnosis. And shortly after, I experienced similar symptoms. And in my early 20s, had to fight to get a physician to take me seriously. After I made a decision to have what was supposed to be a preventative surgery, I was diagnosed with breast cancer and surgery, and I was only 24. And so as I decided to go into healthcare because I wanted to fix the experience I had, it became so much bigger than me. It became so much more than just advocating for yourself. And that's really where Gabby was born.
Yeah, that's a great story. Thank you for sharing. And I'm sorry about your mother, and I'm glad that you are fighting the fight for yourself as well. Thank you.
Thank you.
Karen and Heidi, please introduce us to yourselves and to Verbena.
So I'm Dr. Karen Petrovsky, and I am a practicing OBGYN. I've been practicing for about 25 years. And over the course of time, I felt that the burdens of really practicing medicine have become progressively more complicated and difficult, really being burdened with a lot of EHR tech that made our lives more complicated, that were with the anticipation of it being easier, in combination with consumers, our patients really having being much more demanding in terms of having easy access. They have it in other consumer industries and didn't have it as much in medicine. And so what I really wanted to find a way to make my delivery of care to my patients efficient and to be present, but without feeling more burdened and more stressed. And in addition, not overburdening the healthcare system, which is just so wasteful and costly. So that was my pain point, looking at it from the lens of both the patients as well as the physician, to really try to find a solution to deliver better care. And with Heidi, I'll let her introduce herself. We were really able to bring that to an incredible journey together.
Thank you. Heidi?
Just a quick intro on me, because Karen really said it all, because she really, this really came from birth from her, no pun intended, but I'm a media and marketing executive, mostly in the women's lifestyle space for the last 25 years. And really started off personally friends with Karen, but when she shared with me this idea 3 years ago and her passion for it, I was able to jump on board and sort of help bring it to life from from being a woman and clearly being someone who believes in what she's trying to do. And on a sidebar note, my father was an OBGYN ahead of his time. And so Karen and I have often spoken about that over our 25 years of friendship. And she's met my dad, and it really felt a really easy calling for me to join her in the Verbena venture. So
You had really seen it through the eyes of someone who is also living it in your own home, certainly. Now, again, we're at a digital health conference, and we're talking about digital health. And part of the challenge of digital health applications and services is that the end user is not always the paying customer. And so and we talked about the B2B to C paradigm. So talk a little bit about your experience with that as a digital health company and how you go about not only, especially Heidi, with your marketing experience, you understand the importance of engaging the end user and the consumer, and that's what's going to drive the payer to pay for it, right? So talk a little bit about your experience with balancing those different audiences.
Interestingly, again, I come from this women's lifestyle brand, and I want to launch my own magazine back in the day in women's health, and love the stories, the articles, the content. And Karen and I have been able to, through Verbena, merge telehealth with content and community, which is so important to the patient experience. And Verbena, sort of, I'll skip to the end. I mean, our vision is to create a complete women's lifestyle brand that has, content, community, engagement, a service that really, and is user friendly and efficient for both the provider and the patient. So we don't want to just have a flat telehealth platform. We want to bring a very engaging and informative solution to women and their providers in the era that we live in right now.
Right, and you almost have three different audiences, right? You've got the consumer, the provider, and potentially perhaps payers and meaning both insurers and employers. So you're really looking at three different audiences and what they're
five, six different audiences.
Right. And Caitlin, you're also, looking at employers and potentially insurers as your paying customers. But again, your end user is the individual patient or woman. So tell us a little bit about how that experience has been for you.
Correct. Yes. Our number one priority is the end user, which is the woman. But and everything that we've done comes from that place. So, for example, we don't think women should have to pay for this, which is why we are going B2B to C. So we're going to market selling to the self-funded employers, as well as eventually the payers and health plans, in order to offer this to their employees and their members for free. It's definitely been a journey, and we still have direct-to-consumer aspects. For example, we'll be launching our app in the new year to a small group of consumers. And it's constantly for us just learning. Originally, when I was thinking of how to solve this problem of delayed diagnosis and women not knowing their risks, I thought, oh, you know what we need? We just need like a WebMD for women specifically about preventative care. And that just morphed and morphed and morphed. And now here we are, solving delayed diagnosis with prediction and eventually becoming an actual breast specialist. And so it's really, I think the whole process of being an entrepreneur and having a startup is learning and being able to go with the flow and change as you're learning all these bits of information. So I'm really excited about launching the app to consumers. We've already received tons of feedback from women just based off of some of the press we've received of how women want this and need this, and they're so excited. And I'm really eager to get health plans and employers on board as well, because we all know due to COVID that for these digital health solutions to support women back in the workforce, now is the time for companies like Verbena, like Gabby. And the employers are really struggling, women are really struggling, and I think there are a lot of incredible solutions that can help plug that hole.
And just to underline that point, you're really talking about retention and maintaining women in the workforce. And you think that this is a differentiating factor for those employers who offer this service?
I think that's one of them. I don't think it's the number one. For us, it's truly, and specifically for self-funded employers, it is a huge cost savings. On top of doing the right thing, on top of attracting employees and retaining employees, ultimately it's a 20-to-1 savings by having Gabby versus having one of your female employees diagnosed with a late stage breast cancer. And we're able to show that within 1 year.
Okay, so you're able to show outcomes. And that leads us to a question about data, right? Because, you know, who wants your employer in your business? Or your, insurers obviously will have access, and you're going through Dame's claims data. So how do you, is there a firewall? And how do you handle that? And I'm going to give you like 4 questions all at once, and I'll get to the.
Okay, I'll see if I can get them all.
Yeah, so basically, how do you handle, what data are you collecting? How are you going, what are you going to use that data for? And how do you maintain privacy? So those are the 3.
Okay, great questions. Yes. As we all know, excuse me, data is king. We need the data because it makes us smarter and it helps us help women more. The first thing a woman does is sees a disclosure statement that basically says, hey, this is your data and our data, and it's not going anywhere else. So I think to more targetedly answer your question, we're not sharing anything we're gathering with their employer. And that's really important because of who we are. As women, when we have a problem with our bodies or a question, the first place we go to is another woman. And that's who Gabby is. Gabby is your mother, your sister, or your best friend, backed by clinical expertise. And if we were selling your data, you wouldn't trust us. And if you don't trust us, then we can't help you. So we are very strict on compliance and privacy, and it's just between us and the user.
Thank you. Heidi and Karen, any well, I know you have thoughts and I know you have answers. How do you all deal with that with Verbena?
Yes, so we, of course, are collecting data and we are doing it anonymously, and all the data that is collected, we're stored on a HIPAA compliant platform. It is not for any other use other than to realize how we can best take care of women for all of their needs safely through a digital opportunity. And realize what can be treated through a virtual first platform safely, efficiently, cost effectively. So that is what we are collecting data for. So not to disperse it or dispense it, just how Caitlin had mentioned, certainly for information as a general, not in a personal way, to effectively and efficiently really help the healthcare system, which is just so exhausted with spending.
And I probably goes without saying, but I'll say it anyhow, both platforms are HIPAA compliant. And that would, of course, be, just the first step. The other challenge that we have in healthcare, and certainly in women's health, is making sure that women of color and their specific needs are met. And that solutions pertain to them. How do you address that with Verbena?
So our platform is for women. It's inclusive of all women. It does not, it's meant to help women who are overextended, regardless of race or color. So there are no boundaries. Women have been excluded from care for all of time. I mean, over 70% of women are the labor force in the healthcare industry, and yet women are the ones who are first and foremost deprived of access to care. So we're inclusive of all with no boundaries. So that helps the working woman who needs a visit but can't take a day off of work to do so. She will have really immediate access to her trusted and personal provider. For the woman who cannot get to the doctor because she's remote or has transportation issues, she will have access to, quick access to her doctor. For the woman who has home responsibilities, she'll have access as well. So really, it offers really a unique and affordable option for all women to be included in routine and regular healthcare, so that she does not neglect herself, really taking care of not only health issues and health problems, but preventative care, so that things get diagnosed early, so that they can be treated much more effectively before it really becomes problematic. So I answer that question that we are inclusive to all women.
And that's a key issue, right? Because there's a concern now that we're going to see cancers diagnosed at later stages because women and men didn't get into preventive health.
You're absolutely right, Mitzi. Yes. And especially because of COVID and even before COVID, that has been something that has really been the biggest landmark in what we're doing, is that these risk models that we studied to inform the one that we made, they're out there. They're only used in clinical settings administered by clinicians, but they're only appropriate for white women over the age of 35. And they're even not that accurate. They're at best a 68% accuracy. And so we started from the point of, there has to be a better way to do this. There has to be a way to help all women. There has to be a way to make this more accurate. There has to be a way where every woman knows her risk. So Gabby is appropriate for women of all ages and all ethnicities, is the most accurate risk assessment model with 81% AUC, and is the first consumer-facing risk model.
Great, thank you very much. Moving on to talk a little bit about the nuts and bolts of investment and what investors are looking for, because obviously without money, it's hard to keep going. We always look at what is the company's competitive advantage and what are the barriers to entry to this space. So I'll start with you, Caitlin. How are you differentiating yourself in the marketplace? And what is it that you have, what is the moat that you've been building so that others can't cross it easily?
Yeah, so I would actually say it's the same three things that I just said. It's the fact that we're appropriate for women of all ages and all ethnicities, so inclusivity, accuracy, that we're the most accurate, and then approach, that we're the first ever consumer-facing risk model. So I would say those are our three items that are creating our moat and differentiating us.
Thank you. Heidi or Karen? Talk to us about Urbina.
You can tag team it.
Yeah, so we certainly have a lot of unique features. I mean, we were built Verbena based on what we really felt was a void. So what we offer is a physician-facing platform that also caters to patients, taking care of women of all ages from menstruation to menopause. It provides very unique care because it is a hybrid model. So whereas it's a virtual first, when the level of care needs to be elevated, there is that brick and mortar to go to, and not with an anonymous provider. It's that provider who you've had that long lasting and trusted relationship. So that becomes fostered. In addition, when you do that virtual first visit, we make that visit a visit with intention by combining what we call an asynchronous visit or information collected prior to that real-time synchronous video visit. So it becomes a focused and very comprehensive visit. So you really can understand what is bringing that patient to the office or to the virtual office. So it really can be a comprehensive, it's a high tech, but with a lot of high touch components to it.
And I want to talk a little bit, because again, you have a somewhat different focus in that you are interacting with your providers directly. So what have been some of the, and I think historically we've thought that, especially I'll just say physicians are not always early adopters. And also they have, a lot of pressures on them, both economic as well as time resources. So how did you connect with those providers to show them the value of what you're doing?
Well, what I want to do is show that this can make their lives easier. So physicians are burning out at record rates. I mean, COVID forced, I think it's about 8% of practitioners closed. The majority of gynecologists are female right now. The burnout rate, because the women are overextended, is high. So what I want to really hope to do is to increase the longevity of the career. I mean, we went into this field to help people, and want to be able to do it as long as we can. So to give an alternate mechanism of delivering quality care. So that really becomes enticing to the provider as well, and allowing them to continue that relationship with their patients.
Thank you. And Caitlin, we talked a little bit on our previous conversation about a platform, and that this is not just, you're not just going to focus on breast cancer, that what you're doing is really very expansive. So talk to us a little bit about your plans there.
Yes, as Karen and Heidi just alluded to, you know, the clinicians are inundated with so much to do. And as they're going out of the workforce, as they continue to be inundated, they don't have time to add one more thing to their list. And OBGYNs and primary care are generalists, and they're supposed to be able to take care of a patient in their general well-being. We see ourselves as your dedicated specialist. So of course, I mentioned that we're starting with breast cancer. We planned to incorporate other preventable cancers, colon cancer, endometrial, ovarian cancer, and eventually other preventable syndromes that also affect women, but all from the place of what can we specialize in, because what are we really good at, so that we can let the primary care and OBGYN shine and really provide great quality care.
Great, thank you. So as entrepreneurs, I'm wondering what the biggest surprise you had that you're facing or that you've faced that came about during your journey. Heidi, you want to take that one?
Sure. You know, definitely a huge surprise for me because, you know, as we know, Karen's a medical doctor, practicing OBGYN, had this idea. By trade, I'm a marketing executive in media and women's lifestyle. And then we sort of had a whole language barrier from entrepreneurship and raising investments and angel investors, golden seeds, and then not to mention, you know, tech and software development team in India. And it was really this huge language barrier and learning curve of things that I personally wasn't used to: medicine, technology, investing. So for me, the biggest surprise was that actually, you know, you live in it and then you can understand it.
And then speak the language.
And speak the language. I mean, my husband is amazed, sorry to say that he can't even believe I can talk this way and have a huge organic understanding of digital health, tech, medicine coming from.
That's the power of women, right, Heidi? We can learn new careers and we can learn new industries real quickly.
So our minds can handle that, and most men can't. I'm kidding. But so and I think I speak for everybody, because whatever, even Karen's background, medicine, not tech, and your background, Caitlin, you know, I mean, we had to through this journey, you know, understand new industries and new businesses,
Yep.
and speak the language. And so that has been, you know, the biggest surprise, and really rather
Empowering.
fulfill it.
Yeah.
And empowering. Yeah.
You know, I'm curious, Heidi and Karen, how did you do that? What was your strategy, or what was the way in which you learned to speak the language? I'm just curious.
Immersed ourselves in immersion.
Immersion. And
It took, I mean, Caitlin, it literally, I remember one day
I
I
didn't know
woke
what a
up.
wireframe was,
Yeah,
you know.
I remember I woke up one day, I'm like, oh, I understand what they're saying.
Or even the whole concept, I think even talking to family and friends who aren't in this tech world, because now we live in our very own bubble of tech and startups. I think even making the realization that I can get investors and raise money without having a product. Who does that? How does that work? Or I don't have to be making money in order to build a company, like these things that, you know, I grew up in an entrepreneurial family, but it was all very tactile and concrete. There's a lot of the startup world that is very up here, and it takes a lot to wrap your mind around, okay, this isn't really all that concrete.
You know,
So was that your biggest surprise, Caitlin?
I'd say that, yeah. I mean, I'm a non-tech founder, so tech, absolutely, steep learning curve. And then just this whole startup world of fundraising and learning the languages and the different stages of companies and, you know, what is traction? What is an MVP?
And so how have you found the funding experience, especially when you're talking about a women's health issue?
Yeah. So it's really hard. And I think as much progress that has been made, there's still a lot more progress that needs to be made. You know, I can't emphasize enough how important it is to have a tribe of women who are also CEOs or also founders or also operators to support you. I think that's been my greatest takeaway and something I put a ton of value in, because the number of times I'm on the floor, you know, while I was raising money, and you just need to be able to talk to someone who gets it and who's been there and is on the other side. As far as fundraising, I tried to raise twice when I shouldn't have. I wasn't ready. And I wish that other women told me it was not the right time. And the difference, I would say, is a lot of men told me, you're too early, you're too early. And, you know, these days, like, what does that even mean? That's not helpful. And what would have been more helpful is, you're too early because, and said, you know, this is what we want to see, or this is what we're looking for. So I had to learn that the hard way by failing twice to raise money. And then when I went out the third time, it wasn't a walk in the park, but it was so much easier. I will say, it's like, once you get the first check, that really is the hardest, is the first check. And I've been told that your pre-seed or seed round, whatever the first round of money is that you raise, will be the hardest. And I'm like, better be. But once you get that first check, then it really is all downhill from there. And although I think that's a little bit of an exaggeration, it gets the ball rolling in a way that it wasn't before. And then, you know, you get 1 to 2 or 3 other angels, and by the time you have maybe 5 angels, then you get your first VC or something. And at least that's how it worked for me. And then it felt like it was basically overnight that we were oversubscribed. And of course it wasn't overnight, but once we just got a little bit rolling, I was telling huge, amazing people, no, I can't take your money at our current valuation. And that's a pretty humbling, having gotten to that spot. It's a humbling place to be, but it also feels really good.
Karen and Heidi, how do you feel about that? Because you guys are a little bit earlier in the process, and I know we talked about funding really early on. And as you know, Golden Seeds has some specific criteria. It wasn't, it was pretty clear. So talk a little bit about how you're hearing what Caitlin's saying and what your experience has been thus far.
So Caitlin, we had the blessing of meeting Mitzi early in our conception pre-product, and was able to hear the wisdom of not ready to raise. So what we needed, we were in a little bit of a chicken and egg situation. We had a concept.
Amazing concept.
We needed
all the wireframes.
We needed the product. We needed money to build the product, and we couldn't raise money without the product. So we self-funded. We're self-funded to date, which does have a little bit of appeal because we are the owners of the product, and now ready for prime time. And now with really a beautiful product, I will say, we're ready to offer it and start raising money so that we can add to it, enhance it, improve it, and grow it.
Great, thank you. And you're about to start a pilot, correct?
Yes.
Awesome.
I will say as an investor, pilots are so key because again, that shows your, it proves your value in the marketplace. It gives you feedback. And again, if you can get a paying pilot, that's even better, right?
And a reputable, a pilot that is very sort of
Yeah.
in the
Yeah. And honestly, that's probably the thing that really like kicked our fundraise into high gear was we got a pilot with a national insurer.
Right, so that's, and
Beautiful,
Caitlin, that's fabulous, and we we will be not.
We'll be right behind you.
Right behind you in a certain way, but yeah.
Okay, you just let me know how I can help.
Seat at the table.
And the way that you all are interacting, I think, is very indicative of how a lot of companies and entrepreneurs and founders in this space are interacting. And when we talked together beforehand, we talked about collaboration. And so Heidi and Karen, how do you see potentially collaborating with other entrepreneurs and founders?
Can I say, I'm going to talk about that, the personal note of that for a second, then Karen can talk about sort of the business side. And this also goes, Mitzi, to your question about the biggest surprise, is that it's a really small community of women, female entrepreneurs in the digital health tech space that we've had the privilege of meeting. I mean, Mitzi, we've met before. Caitlin and Karen and I, we have people that we know through all of this networking, and that has been in the support, the collaboration, and the sort of cheerleading, camaraderie has been really an amazing surprise. And with that, potentially we can go to Caitlin as in a conversation, and Karen has even other ideas of other sort of digital health plug-in techs that per your question. I just wanted to go into the
one of sorry, go ahead, Karen.
No, go ahead.
I was gonna say
No.
one of the things I love about this space and other female founders in this space is that historically, if there were 10 seats at the table, there was maybe only one for a woman. And now we need to call on all of us to realize that every single seat is open to us now. And that when one more woman gets at that seat, we are all succeeding. And so I think it is crucial that in any way possible, we're not competitors. We're all working to solve this greater problem that is access, that is women in the workforce, that is women's health. And only together are we really going to be able to make a difference. And so even if at some point, say, for example, Maven or Tia is eventually a competitor of ours, I'm working with them, they're working with me, because at the end of the day, them succeeding is me succeeding and vice versa. And I think that's really important. So I get so excited about helping other female founders, other women's health companies get to that next stage, or, make an intro or do a partnership or a pilot or help in any way, because I think we can all think of a time on our journey, and hopefully multiple times during our journey, that someone did that for us.
Absolutely. Karen, did you have something else to say?
No, just I completely agree. I mean, that the community is small, but it's incredible to see women in tech. I think women should be in femtech, and it's incredible to see how we do help each other and all elevate each other's platforms. I mean, I could absolutely see Gabby having some kind of collaboration with Verbena. I mean, we, as one of the asynchronous forms, it's cancer surveillance, how to screen for breast cancer, colon cancer, skin cancer, endometrial, ovarian, all of the issues that Caitlin will be addressing with Gabby. Whether it's working through other digital laboratories, telepharmacies. I mean, it is a very interconnected roadwork.
Right, and there's a lot of work to do, right?
Always, which is good. It keeps us honest, it keeps us improving, and it keeps us advocating for women.
Absolutely. So if you were going to, provide some advice to some of the entrepreneurs that are listening today, what would be your key piece of advice for them?
Well, first, I think you have to know what your problem is. What are you trying to solve? What are you trying to improve? Where do you think there's a void? Once you can sort of hone that and know what that problem is, you need to make sure that you have a great team of people, and rip it out, and really talk about it so that you can cull together a solution and then build it. And it's going to be lots of hours, lots of work, probably require lots of money, but don't give up, because I mean, it's so gratifying and satisfying to get to that point.
Sure. Thank you. Caitlin, any advice to the audience?
I would say, and I know I've already said it, so I don't mean to be a broken record,
And working with your best friend doesn't hurt.
which is amazing. That's incredible. I'm actually jealous. I'm a solo founder. So, but I would say, and maybe it's more important because I am a solo founder, is having your tribe of other female CEOs, operators, et cetera, crucial.
Absolutely. So we just have a few more minutes left. Caitlin, what's in the future for Gabby?
Well, we will be launching our app direct to consumer in the new year, as well as raising our seed round in Q1. We will be positioning ourselves as a specialist, so we'll be able to order all the tests, receive imaging, et cetera. That, I would say, is what's happening in the next year.
Wow, that's a full year. Congratulations. Karen and Heidi.
Yeah, I would say, well, I guess in the near future, we're ready to pilot, we're ready to do initial round of raising funds. But I think, our mission and our vision has always been to be a complete women's health and wellness resource. So from service to content and community, Caitlin, you said we laughed, Karen and I laughed when you said something about the WebMD. We want to be the WebMD for women's health, take self and WebMD, and that's who we want to be. So I think short term, we've got a lot of things that we need to do to get to where we need to be, but we've always never lost sight of the bigger strategic vision is this, women's lifestyle brand that offers service and content and community. And we want Verbena to be synonymous. We want it to be an adverb, a noun, an adjective. We want people to Verbena. We want people to, we want Verbenites. Like we want that word to be synonymous with, women's health, and maybe Verbena and Gabby will go out together.
Well, I'm always energized by these kinds of conversations because, again, one of the reasons I got into angel investing was because I was seeing how these women's health companies were really moving the needle in women's health. So thanks to the three of you for all the work that you're doing and your companies. And I am going to toss it back to Julia if she is in the vicinity.
Thanks, Mitzi.
Yeah, thank you,
It was
Mitzi.
great to see you again.
Yes, thank you all so much. This is a pleasure.
Everyone.
Caitlin, offline, we need to
Agreed.
connect.
Well,
All
hey.
around.
Well,
Julia.
talking too, that's fine.
That's all good.
Where is everyone based?
So we're in New Jersey.
I'm
Where are you, Mitzi?
I'm on the West Coast right now.
Okay. I'm normally on the West Coast. I'm currently in Colorado.
Ooh, that's
Nice.
fun. All right, that's good. And we're all over.
So while we're just chatting, the one question that came up was, what are the resources that you need now going forward at your stage?
I will let Verbena answer first since
Well,
the fundraising.
what we'll need is financial assistance, again, so that we can really enhance the platform and grow it. I mean, we have visions, right? We have a great blog on it. We anticipate, having educational webinars. We need to further enhance our connectivity with some of the EHR systems and the APIs that are necessary.
Yeah.
marketing. So
We need money. Bottom line is, so Caitlin, we're so impressed by the raise that you have done and accomplished, and the rounds that you've gone through, and that you were hit and then came back up, climbed back up and got what you need, and they're turning people away based on your valuation. I mean, that is so impressive. We hope to not someday, but that's what we aspire to.
You can do it.
and going back to the question of, what do you tell other female entrepreneurs? This concept of remote access for me happened well before COVID, a couple of years before COVID, and I brought it to the attention of other providers, and people looked at me like I was crazy, why I would want to drive my patients out of my office. It definitely, I was knocked down, I licked my wounds, and definitely saw, the crisis of COVID as an opportunity to sort of be the phoenix and go again. So with that, I say to other women with ideas, like, just, it's okay to fall down, but you got to get right back up.
I think the really success is not necessarily that you are doing anything different, but it's that you know what you need to do, and every morning you get up and you do it. And it's persistence and it's determination, because when all of a sudden I was saying I can't take your money and we were oversubscribed, it wasn't because I was doing anything different. It was because I was just keeping on. And that's really, it's what you got to do. And a lot of times you're knocking your head against the wall and you're like, am I crazy? If crazy is doing the same thing over again and expecting the same results. But really it's rinse and repeat.
Yep.
And and again, since we're waiting for Julia, I mean, it's.
I think we don't have to. I think we. That's okay. Finish your.
Just believing in your product. I mean, clearly, Caitlin, yours come from a personal place, and Karen's personal. I'm personal too with my dad, and just believing in the product, and that can really go a long way.
Yeah, that's empowering.
Terrific. So again, thank the three of you for a great conversation. I really enjoyed it.
Yes, thank you, all three of you.
Hi, Julia.
Thank you very much, ladies, for joining and for your time. It was a wonderful panel. And yeah, thanks so much for joining us today.
Thank you.
Yeah.
Bye.
Take care.
Bye. All right. So up next, the fun doesn't stop here, guys. Up next, we have another panel coming up. This time talking about the future of pharma and digital health. It's a star-studded lineup. So I will, if you are in the audience, jump on over to the link in the from the agenda side, and I will set up our new panelists right here, right now.